Prostate brachytherapy is changing. A new technique offers all the benefits of a one-stage treatment, but with none of its compromises. 4D brachytherapy. The team behind it are consultant urologist Professor Stephen Langley and consultant oncologist Dr. Robert Lang of the St. Luke's Cancer Centre. Together, they've been working at the forefront of prostate brachytherapy for over 10 years.
4D brachytherapy is a one-stage, real-time brachytherapy implant technique using a combination of stranded seeds around the outside and loose seeds in the centre. The fourth dimension is time, and to do that normally would take several hours in most techniques.
It encompasses some of the aspects of a two-stage technique and a one-stage technique, but combines them in a way that really does this in a quick time.
4D brachytherapy has allowed us to avoid the pre-planning scan. So it allows us to undertake the procedure as quick as if we were doing a two-stage technique, but we can undertake both the planning scan, the planning and the implant, all within approximately 45 minutes.
Having trained in America and performed the popular two-stage Seattle method for many years, the team was looking for a way to improve the technique and outcome for patients.
It required two substantial visits to the hospital. It required 2 anaesthetics. And whilst we could get a very good coverage around the prostate gland, sometimes we were covering a larger area than we wanted. And that could have an adverse effect in terms of erectile dysfunction and other urinary symptoms.
The concept of a one-stage treatment was attractive, but the length of time involved was a major issue.
The patient would be under anaesthetic, would have a planning scan, and then all the seeds would be cut in their strands, loaded into their needles, and then a plan developed as well.
Both the patient is anaesthetised for a prolonged period of time, and of course the theatre is in use.
Then the clinicians would start implanting the seeds, and the whole procedure would take between 2 and 3 hours. And we really felt that this wasn't advantageous to the patient.
In an afternoon's theatre list, only 2 patients could probably be treated in this way.
The challenge seemed clear. Find a way to accurately predict the number of seeds needed, prepare them in advance, and you can dramatically reduce the theatre time of a one-stage treatment. With this in mind, the team started looking into the relationship between the radiation dose and different sizes of prostate.
Having treated about 1,000 patients, we started to notice that there was a pattern in the number of stranded seeds we needed around the outside of the prostate and their position.
There were limited differences in the strand length. There were fairly close similarities to the amount of radiation that we had to order that allowed us to group different sizes of prostate together to get a solution that would allow us to have the right amount of radioactive material to perform an implant and give excellent dosimetry.
And that was really the key. Knowing that, we could then order those in advance so that when the patient was under an anaesthetic, we can miss out so many of the steps required normally, and it would allow us to undertake the implant in a far more time-efficient manner.
This breakthrough meant a nomogram could be produced, working from a simple ultrasound taken at clinic to calculate the right number of seeds. And it's this nomogram which is key to 4D brachytherapy.
The whole technique is possible because of the nomograms we've developed.
A lot of the pre-work has already been performed based on the nomogram that has told us how many seeds we're going to require. Those are pre-ordered, pre-loaded and ready to be implanted.
It allows us to use the simple measurements in outpatients to essentially deliver the first draft for that patient.
And it's a relatively quick process for the dose planning computer to assess exactly how many we're going to need and where those seeds need to be implanted as well.
This hybrid approach has shown both excellent levels of dosimetry and greatly improved side effect profiles for patients.
We can get a much better coverage of radiation around the prostate gland without risk of the seeds migrating away from the prostate. The loose seeds allow us to be very specific as to exactly where we implant the seeds within the gland. That minimises the side effects of urinary symptoms and also optimises the chances that the patient will retain their erectile function.
This film is designed to show existing brachytherapy centres how 4D works. Step by step, it outlines the way the treatment has evolved, giving tips on familiar techniques.
The seeds chains are being implanted in the longitudinal view,
as well as those less common.
I'm going to insert it into the mic applicator. This cartridge has 15 loose seeds in.
Ideal if you are considering using 4D brachytherapy in your practice.